Every year in the UK, about 2,000 babies are born to women with epilepsy. My kids have been those kids because I have epilepsy. Epilepsy and having kids comes with certain complications and certain concerns, and when it was something I was looking at and going through, I would have found a video like this quite helpful, somebody's point of view from somebody who's kind of gone through it and gone through the process. So I thought I would make it. So basically I'll give you a quick background of my epilepsy so you can kind of get an idea of that, because everyone's condition is different and there are so many varying levels and different types. And then I will talk about thinking about getting pregnant, actually getting pregnant, going through the pregnancy, having a baby, living with a newborn, and then also looking to the future as to whether my kids will have epilepsy. I do want to stress there are so many stats and facts and figures about what could go wrong and what could happen to your baby and la la la, and I'm going to throw numbers at you in this video. But the biggest number I think to bear in mind is that in 90% of cases, everything will be fine. You will have a healthy pregnancy and a healthy baby if you have epilepsy, and if you have epilepsy not on medication or on medication, 90% of the time it will all be fine. I am going to mention some facts and figures as we go through this. Some of it is just stuff that I have gleaned along the way, but anything that I say that's kind of official sounding, I've done a little bit of research for this video, and everything is taken from the NHS, from a website called GP Notebook, which is a GP website, and from NICE, the National Institute of Clinical Excellence. So they're all resources that I would trust for the information, so hopefully it's all okay. So starting off with a little bit about me, I have quite mild epilepsy. I got it when I was 15, 16. Doing my GCSEs in school. I had a piece of coursework due in that I hadn't done because I'm a last minute kind of a person, so I'd been up till kind of the wee small hours in the days leading up to it. So sleep deprivation, stress, not eating very well because I didn't eat very well when I was a teenager because I was an idiot. All three classic triggers. I had a seizure in school. Good times. And it was a full-blown seizure. That's the kind that I have. Used to be called grand mal seizures. These days seems to be called tonic-clonic seizures, which I kind of prefer grand mal. Grand mal sounds a bit dramatic and exciting, whereas tonic-clonic sounds like, I don't know, a cocktail. So I have those. They are the fall on the floor, twitch about, lose consciousness, that kind of seizure. So I'm about 16 years old and I was prescribed sodium valproate, which now would be a complete no-no. That now is no longer prescribed to women of childbearing age or who may become of childbearing age, but we are talking 20 years ago. And this shows you how much epilepsy research changes all the time, that 20 years ago, a 16-year-old girl was prescribed sodium valproate. Crazy looking back at it now. 2 years later, I hadn't had any seizures, I came off it, and I just lived my life medication free, and I was basically having around one seizure a year. So back I went to the consultant and back on medication. This time I've gone on to lamotrigine, and I take 2 tablets a day, 1 in the morning, 1 at night, and I haven't had a seizure since. And we are talking now 15 years. So that's enough about me. Quite mild. I have the big show-stopping seizures, and it's been well controlled for a good number of years, but I am on an anticonvulsant drug. And it has no real impact on my life until I wanted children. If you have epilepsy and you want children, the main piece of advice is go and see a consultant before you get pregnant, before you start trying to get pregnant, because there are steps that you should take to make it the safest possible option. So planning a pregnancy, I went to the GP, said I'm planning to have a baby. He made me an appointment with a consultant and we just talked through all of the options, talked through all of the possible complications. So the possible complications that mainly come about for women with epilepsy, you do have a slightly increased infertility rate. You do have an increased risk of miscarriage and stillbirth, and then you do have an increased risk of abnormalities in the development of the baby, whether they're physical abnormalities like heart problems, cleft palate, spina bifida, or developmental delays. All of those risks are increased if you have epilepsy. That sounds terrifying, but you have to keep those numbers in perspective. So for example, the miscarriage and stillbirth one, you can read a stat, in fact I'll read you. Stillbirths and neonatal loss are up to twice as likely among pregnant women with epilepsy, whether or not they take anti-epileptic drugs, compared to those without epilepsy. That sounds, it's a foregone conclusion it's going to happen. Twice as likely is a terrifying statistic, but you have to put that in perspective. So looking at Tommy's kind of stillbirth charity, that says that currently the rate of stillbirth is just over 4% in every 1,000 births. So it's a horrible figure, but it's a very small figure. And even once you double that, let's round it up to 9%. So it is a horrible figure, and it's a horrible thing to consider. And anyone who goes through it, my heart just breaks for you. But it's a small number. Compare that to 91, which is a big number. So as much as the stats sound just horrific, the likelihood is on your side that it will be okay. So we had all these discussions with the consultant, and the main thing that you need to consider is have a look at the drug that you're on. Is it the best drug for pregnancy? Should you consider changing? Do you change your dose? The ideal scenario is to be on one kind of medication rather than lots mixed together and on the lowest possible dose. I actually had two conflicting experiences with this. With my first child, we were based in Bristol and went and saw a consultant there, and it was recommended that I would increase my dose throughout the pregnancy and then decrease it gradually when I had the baby. For my second pregnancy, we were based in Cardiff, and I saw a consultant there, and they said, no need to change, you'll be fine. And I went, well, last time I did. And they said, oh, right, oh, well, if you did last time and it worked for you, we'll do it again. So it doesn't seem to be really a hard and fast rule. So you just have to weigh up what's right for you in those circumstances. And the only way to do that is to have a proper conversation with a consultant. Never try to change medication yourself. Never make decisions by yourself. You know that. I don't need to tell you. The thing that you can do to help the chances of everything running smoothly is to take folic acid. All women who are pregnant should take folic acid, but for the majority of women, it's a low dose. I can't remember what it is. Is it 4 milligrams? Something like that. For women with epilepsy, it's an increased dose that you will be prescribed, 5 milligrams. In terms of becoming pregnant, I briefly touched on some of the complications that you can have with that in terms of increased infertility and also increased chance of miscarriage. There's so much research that still needs to be done, and so one thing that you should definitely do if you become pregnant is sign up for something called the UK Epilepsy and Pregnancy Register, which collates information about the pregnancies of women with epilepsy and the births, the outcomes of the births and the outcomes for the baby. Please do that for the women of the future who are having babies and want to have the best information possible. So once you are pregnant, as I said, you should continue taking the folic acid throughout the first 12 weeks of your pregnancy. Also, with both of my pregnancies, I had an extra scan. I had a growth scan at, I think it was 32 weeks, which is nice. A little extra chance to see your baby. I was incredibly anxious in my first pregnancy, less so with my second, because I suppose I was a bit cocky because I'd been fine the first time. But in my first pregnancy, I was so anxious that something would go wrong and that there would be a problem in the development of the baby. It was such a worry. And every scan, you know, the 12-week scan and the 20-week scan were just huge dates in my mind to be able to go and see what was going on, particularly the 20-week. In my first pregnancy, I didn't buy a single baby thing or do a single baby related thing until I'd had that 20-week scan. To have to face the decision of what you do if you find out there's a serious problem, I wouldn't like to have to make that decision, and I really feel for anybody who does. I was very lucky with both of my pregnancies. They were a breeze. I went through them no problems, scans all fine, medication all fine, seizure free, no issues whatsoever, absolutely fine. And as I said at the beginning, for 90% of women, that will be the case. You will have a healthy pregnancy with no complications. If you find that complications arise, all you could do again is take the best medical information that's available at the time and make decisions based on that. So I breezed through my pregnancies. Turns out I'm very good at pregnancy, not so good at birth. Slightly disastrous births with both children. I think with my eldest it was complicated by the fact I had a GBS infection, which was discovered while I was pregnant, which it turns out I was very lucky to have that discovered because it's not routinely tested for, which I think is bananas. This is a whole separate video. One thing that I was really worried about was, am I going to have a seizure while I'm giving birth? Because if lack of sleep and stress are a problem and you're going through a really long birth, it sounds like an occasion where that kind of thing might happen. The official advice is that the risk is quite low. It doesn't generally happen that you have a seizure during birth or in the 24 hours afterwards. The risks are low for that. So that was something that put my mind a little bit at ease. It is very much recommended if you have epilepsy, whether you're on medication or not, that you have your baby in a consultant-led maternity unit. Home birth not recommended, water birth not recommended, because even though the risks of seizures are low, it's a risk, and why would you take any extra risk? That was the way I felt about it. If you feel strongly that you want to have your baby at home in a birthing pool in your living room, that's your choice, and this should always come down to your choice. For me, my choice was to minimize the risk as much as possible. So in both of my birth experiences, they were in consultant-led units. They also say, and I can't quite remember the details on this, I should have looked this up, but that the baby should have a vitamin K injection straight away after birth. It's something that I think is recommended to all pregnant women, but there's been a bit of hoo-ha about it and some people don't like it. But it's especially recommended if you have epilepsy. So it's something that, again, I had with both of my kids. So congratulations, you have a baby! You are now incredibly sleep deprived and incredibly stressed and have a lot of pressure on you, and are you eating properly and are you breastfeeding? All these things! For me, the biggest question was about breastfeeding. What do? I am on medication. The baby has obviously been getting some of that medication while it's been in the womb. It's now going to continue to get that medication while I'm breastfeeding. So obviously, babies getting medication, not great, would be avoided if possible. But what they say is that the benefits of breastfeeding outweigh the risks of them taking on some of this medication. You obviously have to make the choice that is for you. I am very much of the opinion that if you don't want to breastfeed, if it doesn't work for you, if it doesn't feel comfortable for you or right for you, you should not be pressured to do it. Again, this is a separate video and I should stop going off on tangents. Obviously, for a lot of us with epilepsy, sleep deprivation is a trigger, and you are never more sleep deprived than when you have a newborn. I didn't know sleep deprivation went to that level. I thought I'd been tired before. This is tiredness in your bones. This is the tiredest of tired you will ever be. If you haven't had your baby yet, it's great, by the way, but you will be ruddy tired. So the risk is there that this could bring on a seizure. For me, I was also bringing medication levels back down, so I had a change in that way. Your body is changing so much. There are increased risks, but there are measures that you can take to try and improve safety for you and your baby. These are things like if you are changing or feeding your baby, do it sitting on the floor. For me, I never liked changing tables that were up high. I always felt like everything was a bit cramped. I quite liked changing my baby on the floor, so I always did that. Feeding, I didn't do it walking around. I generally did it sitting in a chair as opposed to on the floor, but that was me. They also say don't give the baby a bath when you're on your own. You should have somebody there doing that with you. Is that practical in real life? I certainly didn't follow that advice. I gave both babies a bath on their own loads of times, but what we had was a little chair that they sat in. I never did the bath where I held the baby and then sort of washed it. Again, because it was just really awkward and I felt like it was going to slip out my arms. But again, it's a personal choice. It's how you feel. If you feel like things aren't quite right, don't give the baby a bath on your own. The other thing that they said was to avoid slings. I wanted to do a little bit of baby wearing, not to an extreme, but we did have kind of baby Bjorn thing and I would have the baby at the front of me. They do say to try and avoid that because obviously if you have a seizure and you fall down and the baby is strapped to your front. That's not ideal. Again, that wasn't advice that I particularly followed. I wore both of my kids in a sling, so again, it's got to be the right choice for you and dependent on your risk. As I said, I have quite mild epilepsy and it's always been very well controlled, so I felt reasonably confident in making those calls to give the baby a bath on my own, to wear a sling and go out with it on my own. Only you can make that decision. And then looking to the future, what are the risks for my children? I have epilepsy, my husband, their father, does not. The official, let me read it to you, says, children with an epileptic parent have an increased risk of being epileptic. With one parent affected, the risk of the child developing epilepsy is 2.5% to 6%. With both parents affected, the risk increases to 15 to 20%. So my kids have a 2.5 to 6% risk of developing epilepsy. So there's a risk for my kids, but there's also a risk of them being quite short because I'm short. There's also a risk of them having quite bushy eyebrows because my husband does. So, you know, you pass these things on, what can you do? I personally would say, as somebody who lives with epilepsy, I do stress again that mine is quite mild, and I know other people, their lives are very much affected by it. For me, other than taking a tablet twice a day, I'm not really affected by it. So if my kids go on to develop it, I will feel guilty because it'll be because of me. But there are worse things to have. So I'll just have to cross that bridge when it comes. So I really hope this video has been useful. I hope you have found it, if nothing else, reassuring that, again, the statistics show that the majority of women who have epilepsy will have healthy pregnancies and have healthy babies, and everything will be okay. It's not okay for everybody, and if you have been affected by this in a negative way, then my heart goes out to you more than I can say. But if this is something that you're planning, please hold on to that positive message that the chances are, the overwhelming chances are, it will be all right. I hope you enjoyed this video. If you did, please press like, please subscribe to see more, and I will see you very soon. Bye.